All right, so today we're going to talk about equine herpes virus. You'll hear me call it EHV. You'll also hear it called rhinopneumonitis. So this presentation is taken from the AAEP. We're going to talk a little bit about some current cases as well. So there are many different herpes viruses out there. EHV1 and EHV4 are the two most common ones that we worry about. And we refer to these both as rhinopneumonitis. It is part of the vaccines that your horse probably gets every year. So you may have heard of those. There is a 2 and a 5 that we see commonly as well. Those ones are almost so common that they're more like the common cold. Almost every horse is exposed to 2 and 5 when they're young. Not uncommon for them to come up positive later in life. But we really, there are some diseases that we associate with those two, but much less common. So 1 and 4 are going to be the two that we worry about and that we have the vaccine for. All right, so EHV1 mostly causes respiratory disease, but can also cause abortions and neurological diseases. EHV4 also does respiratory and very occasionally abortions, but really very rarely associated with the neurologic form. So if we're talking about the neurologic form, it's almost exclusively EHV1. So the respiratory disease we see with this, and that's what we've talked about in previous lectures, is the respiratory form. So most commonly in young horses, and they get exposed early on in life and have symptoms and then usually get some amount of immunity, but we can see them get it over and over throughout their lifetime, just like you can get the flu more than one time, very similar to that. So we do see outbreaks, certainly in high dense environments. So a lot of horses in a small space and anytime they're stressed. So auctions, showing, racing, more commonly to have outbreaks. Older horses certainly can become what we call subclinically infected. So that means they're not really showing a lot of signs. So you don't think they're sick, but they can still be shedding the virus. So they unfortunately are then exposing other horses unknowingly to the virus. All right, so our respiratory signs, as you guys probably remember, are going to be mild fever, coughing, nasal discharge. Typically a clear discharge, but we can get it as a progression to get thicker and snottier as they progress through the disease. But typically starts out as clear to white, just like influenza would, and then progresses to be a little bit more yellow and thick like a strangles would. So unfortunately, we can't tell the difference on clinical signs alone. All right, incubation period is typically fairly short. So within 2 days, some horses will start showing clinical signs after being exposed, but can be as long as 10 to even 14 days. So there can be kind of that lag period where they've been infected and then you move them and you don't realize that they're going to get sick from wherever they were last. So, you know, how do these horses do? Most of these guys do just fine. So we try to minimize the stress. We rest them just like when you're sick, you stay on the couch. So we try not to exercise these horses too much because their airways get quite inflamed. And so we want to give them adequate time for that respiratory tract to heal before we put them back to work, because we certainly can see it limiting their performance. All right, so the abortion form, again, most commonly EHV1, but occasionally EHV4. Typically no signs of warning. So mare is looking good. She has her baby on board. Everybody is doing fine. They can abort as early as 90 days into gestation, but most of these are going to be what we call late term abortions. So they're going to be 7 to 7 to 11 months to term. These babies, usually come out fairly well formed at that age, but they'll have signs of basically in utero respiratory disease. We do see what we call red bag abortions with these, so that the baby is passed within the placenta, so they never kind of bust out and come through it. And that can be, a sign that we're looking for something worse. Biggest concern is these aborted fetuses are riddled with virus. And so all of the fluids, all of the placenta, the baby itself, is all a source of infection for other horses. Oftentimes our brood mares are kept together as a group or a band out in a field, and all the other moms come over and sniff the new baby, and that can certainly lead to an outbreak. All right, so the most important one that we're going to talk about today is the neurological form. So the neurological form of this disease can certainly be fatal, not always, but certainly has a higher likelihood than the respiratory form. Our big concern for boarding facilities, racetracks, and horse shows that these horses can be spreading this virus to each other. So most horses are going to show those respiratory signs 1 to 2 weeks prior to the development of neurologic signs. However, they do not all. So this is most horses start with respiratory and then progress to neurological. But we can have horses that are neurological with 0 respiratory signs. Stress, such as shipping or a surgery, can certainly trigger the onset of neurologic signs. This virus actually affects the spinal cord and the brainstem in the neurological strain. All right, so these horses look much different than our respiratory horses. They typically start with just incoordination and hind end weakness. So the horse is stepping funny in the back end, or when it's walking straight, its back end wants to trail off to the side. So it looks like they're doing a haunches in or a haunches out when you're actually just walking them straight down the aisle. They can trip, they'll drag their toes. As they get worse, we will start to see horses that dog sit like this. Obviously, a very abnormal way for a horse to be, where they can get their front end off the ground, but they just can't coordinate that back end to get up off the ground. Urinary and fecal incontinence because of the lack of communication down the spinal cord. So these horses will actually dribble urine. So they'll just stand and leak urine down their back end. So we get a lot of scalding of the skin as their bladder just kind of overflows versus being able to urinate normally. Fecal incontinence. So again, these horses will just pop out a couple of piles or plops of poop every once in a while. They're not making a big old manure pile. And the manure tends to be kind of almost log form. So instead of having the nice little balls, it kind of comes out as one big clump. It's not necessarily diarrhea, but they're just not making those little sacculations to make them into little manure balls. So it kind of comes out as a big clump. All right, so the most serious of these cases end up being eventually down and unable to rise. And as long as they stay standing, we can do okay. But once they're down and unable to rise, it carries a very poor prognosis of them ever regaining function. So how do they get it? So transmission is going to be via the respiratory route. So infected droplets of that nasal discharge, if they have it, if not, just the normal breathing or that little normal drip they can get from their nose will spread. So the virus will continue to be shed in their nasal secretions and breath for up to 14 days. So these horses that are positive need to be quarantined for a minimum of 14 days. But we can also spread this virus. So you wipe your horse's snot, or he sneezes on you, and then you walk to the next horse and they sniff you or lick you. They then can inhale those particles and cause, that virus to start up in them. And like I said earlier, that aborted fetus, fetal tissues, all the fluids are contaminated as well. So we can have those transmitting horse to horse. All right. Without disinfection, the virus actually can live for several weeks in the right environment. So obviously disinfection is going to help us here decrease the chances that we are going to be spreading this virus. All horses can be carriers. So these are those subclinical horses where it seems like maybe only one horse in the barn is necessarily affected. Many of the other horses could have been subclinical, not showing signs, but able to spread the virus to their friends. So how do we know that this is what's happening? So we take those clinical signs, we do our exam, do they have a fever or not? Do they have nasal discharge or not? Do they have, lethargy, depression that comes with those? Are they showing neurological signs? We can do either a nasal swab to look for the virus directly there or through their blood. Most of these horses will be positive on both. So we'll be able to find the virus circulating in their bloodstream and in their nasal secretions. PCR is the type of test. Polymerase chain reactions look for the virus in very small amounts. So it doesn't take a lot of the virus to be present. This test kind of amplifies or creates more of the virus to be tested so that we know for sure if it's in there. So it doesn't take a large sample to find it. So there's a couple different options of looking at their CBC, looking for it. We can also do a titer of their serum, but we'd have to have them tested twice. So 2 to 4 weeks apart, basically showing a rising titer tells us that they were affected and mounting an immune response to that virus. Because many of these horses have been exposed before or vaccinated before, they're going to have some baseline level on a titer. And so we would have to show that that titer is rising to know that it's a current or an active infection and not just from their vaccines or from an old a time they had it in their past. All right, so EHV1 is a virus, so antibiotics are not helpful here. Really, the only thing we can do is supportive care. So basically, we're trying to give the horse the best environment to fight off their illness on their own. So it's just like us, we get, good food and hydration and rest, and you get over your cold or your flu. These horses are very similar in that, certainly if they have fevers, we can treat the fever. If they're dehydrated, we can hydrate them with fluids. They have tried antivirals in these. It's questionable how well they work. At some point, it's worth a try, especially on a horse that's worth it, the money, but they can get very expensive. Antivirals are not cheap. In humans, there are products that you may have heard of like Tamiflu or Valcyclovir. They help to fight chronic and acute viral infections. So different than an antibiotic, but much, much more expensive. All right, so treating the fever, so some drugs would be bute or banamine that are anti-inflammatory in nature. Again, IV fluid, so sometimes hooking these guys up in a hospital to a line. If they're not able to stand, we can put them in a sling. That comes with its own host of problems of bed sores and that, because horses are just way too heavy to be hanging in a sling for a long period of time. So if they can stay standing on their own, they have a good prognosis. It's not quick. Typically, recovery can take weeks to months. They get over the initial signs, but the spinal cord and tissues are very slow to regenerate and recover. So it can take a long time for them to return to normal. And some of them will have residual deficits forever. Once they go down, though, prognosis is quite poor. They're almost impossible to get up. Even if we do sling them, like I said, the chances of them pulling through are pretty poor. So most horses, once they're down, we do recommend euthanasia. Any questions so far? All right. So moving on to vaccination. So vaccination for the respiratory form of EHV 1 and 4 doesn't always prevent the disease. Just like you getting your flu shot, you can sometimes still get the flu even though you've had a flu shot. Even with EHV, we still see some cases of viral transmission, but the goal of the vaccine is that is much less. So hopefully they don't. And if they do, the severity of their clinical signs should be a lot less. So they should have less shedding of the virus, so that they're less likely to spread it to their friends, and their symptoms should be a lot milder. All right. So as far as vaccination goes for EHV 1 and 4, the majority of the time we're going to give these as a single injection. They can even be mixed together with some of your other diseases that you guys vaccinate for. So if your horse is getting a Viterra Gold or a 6-way, EHV 1 and 4 are included in that, but it also comes as a standalone vaccine. So typically as baby horses, they're going to get their first dose between 4 and 6 months of age. They're going to get a second dose a month later. So no matter when they got that first dose, if it was at 4, then they get it at 5. If we waited till they were 6 months, they're going to get it at 7 months. And then typically they go on an annual schedule from there. So, most horses are born in the spring, early summer. And so 5-6 months later, we're going to go ahead and get them their first 2 boosters. So oftentimes that's, November, December. And then when spring vaccines come around, so again, we're starting those now, but March, April, typically for this part of the world, we're going to do that annual vaccine for them. Typically after that, most horses are on either a 6 or a 12-month schedule. And that really is going to depend on their risk. So this is one of those vaccines that we call risk-based. So it is not part of the core, but certainly horses that are at risk. So those horses that are showing, traveling, that are young, that are at boarding facilities, that are mixing with other horses, we do recommend a 6-month interval for them. All right. So every 6 months for most of these horses, certainly a lot of the events that you guys may be going to are requiring these now. So new ruling a couple years ago that all of our recognized events require a 6-month vaccination schedule. So that means they're going to get it as part of their spring vaccination package. And then in the fall, we're going to booster that flu rhino again. Most of the big show facilities already require that. And so if your horse is doing that, they're already kind of on that schedule. The goal is that they've had a vaccine 2 weeks prior to entering a show, because vaccines aren't immediate. It takes the body time to make those antibodies to be protective. So they really shouldn't be vaccinated right before the show because it won't give them the protection they need. And then they're good for about 6 months. Over time, we know that immunity wanes or decreases pretty quickly. So they're not going to last them all the way out to next spring. So we'll come back with a fall booster. All right. When we're talking about the brood mares, we use a little bit of a different vaccine type that is specifically for EHV1 to prevent those abortions. So these are for brood mares only. We're typically going to do 5, 7, and 9 months for those guys with the goal of preventing the late-term abortions. So on, heavy populated farms, we'll even start a little bit earlier at that 3rd month of pregnancy. So they'll get a series of 3 to 4 of these EHV1 specific vaccines to try to prevent abortion. All right. Unfortunately, there's really no vaccine that has any sort of label or claim that it fights off the neurologic form. Again, the benefits of the vaccine from decreasing shedding and decreasing the respiratory form should reduce the incidence or the chances that we're going to be spreading around the neurologic form. But there is not one signal vaccine that specifically fights off that neurologic form. So what happens if we're having an outbreak? So it doesn't take a lot of horses to be considered an outbreak. We worry about this disease spreading quickly in populations because it is, a respiratory spread. It's not like they require a blood transfer or something. So certainly horse shows and boarding facilities are a great place for this virus to move horse to horse. So our biosecurity protocols for most of our diseases are the same. So we're going to isolate our new animals as they're coming to the farm, ideally a minimum of 21 days. That allows us to make sure that the stress of shipping or transport hasn't caused them to start shedding anything. Anything that, or any equipment, trailer, whatnot that has been in contact with this horse should be disinfected. The biggest thing about disinfectants are they rely on contact time. So if you're spraying the sawdust, you're not going to be able to cover all of the surfaces or keep them wet. So we want to first remove all of the organic debris, so manure, sawdust, snot that are on the walls. So clean first and then disinfect second. So a 1 to 10 bleach solution or a commercial based cleaner. There's lots of them out there now that you can use that will fight off these viruses. So anything that's been in contact with the sick horse for sure. And then, monitoring these horses while they're in isolation, taking their temperature twice a day. Certainly if we get a horse that does have a fever, that they are removed from the general population as quickly as possible, moved into a isolation or quarantine stall to try to break the chain and stop the spread. All right, so moving horses during an outbreak, many states actually, this is a reportable disease. So the EHV1 respiratory form isn't reportable in Ohio, but the EHV1 neurologic form is. So anytime we have a horse with suspected and then confirmed positive EHV1 neurologic status, we have to report it to the state vet. So the state vet then kind of comes in and dictates how long the barn is quarantined for, which horses are allowed to leave. If it's a large facility, sometimes only certain barns can be quarantined versus the whole facility, depending on where horses have been moved and whatnot. So sometimes we don't get a lot of say in that. Once we found the horse, everybody kind of gets on lockdown until we have the outbreak under control and we can kind of trace where these horses have been. So, making sure your horse is vaccinated is going to be very important. We use a couple different ways to signify that a horse is vaccinated. So we can have their invoice from when the veterinarian gave them their vaccines as a official record of vaccination status. You can get an actual certificate from your veterinarian, basically from the vaccine manufacturer saying that your horse was vaccinated with whatever certain vaccines they got that day. Or you can have your veterinarian email you over a copy of their medical record that would indicate all of their vaccines. And third, fourth, I guess, if you're getting a health certificate to travel, those vaccines will be recorded on your health certificate if you request for them to be there by your vet. Certainly recognized shows will utilize that as a single source of information. So basically a health certificate should accompany any horse that is crossing state lines at any time. It is part of the government's way of controlling transport and transfer of diseases. It allows us a record keeping system so that we could look back if there is an outbreak of contact tracing, of saying, okay, where were you when this outbreak started? Where did you move to? Who all could you have infected? So just like when COVID first started, they were doing a lot of contact tracing of people, of which airplane were you on? Where did you go? How did this virus get here? So same idea. These are not new. Most states require them within 30 days. If any of you went to Tryon, they were requiring them within 15 days of transport. If there's a serious outbreak at the time of competition, some of them will even shorten that to 3 to 5 days. That's rare, but on occasion, if there is something going on and that's still safe to be having the show, that it's not completely canceled, they'll just shorten the time from your time of inspection to the time of arrival. So basically a certificate of veterinary inspection, or a health certificate, or a travel certificate, as some people call them, basically is an inspection by your vet. So your vet comes out, looks at your horse, for signs of disease. So do they have nasal discharge? Do they have ocular discharge? Is there a cough? Are their heart and lungs clear? Do they have a fever? We also ask questions of, is anybody sick on the farm? Have you been in contact with anybody or any horse that was sick? If any of those are positive, then we won't write a health certificate because we don't want your horse to be spreading anything. Once that inspection is done, all of that is recorded. Most veterinarians use digital certificates now, so we generate those basically through a website, and those certificates then can have your vaccine status, the date of exam, your horse's temperature. They are specific to where that horse is going. Most health certificates can include up to 2 destinations. So if you're going to go from, Ohio to Aiken for a week and then to Florida, one health certificate can actually cover that travel plan. If you're going to go to Aiken this week and then come home for a month and then go to Florida for 2 months, you'd have to get a second health certificate to go to Florida. But they are site specific. So your veterinarian will ask, where are they going? What's the address? Who's the person to contact down there if there was a concern? So they'll ask for a phone number, and then write you that health certificate. If you've ever gone to Florida, they'll actually pull you over as you cross the state line, and check all your health papers. Other states are a little bit more lenient, and they don't actually look for it unless there's an issue or a problem or you get pulled over. Then they may ask for your paperwork, and you should be able to produce that either in paper form or electronically. In order to write the health certificate, they have to have a Coggins test within the past 1 year. So that all goes into that health certificate. So all of that information will be in one place. There are options with the USEF that if you gave your horse vaccines on your own, you have to provide documentation that of where you bought the vaccine, the manufacturer of the vaccine, the lot number, and the expiration date of that vaccine, as well as when you administered that vaccine. So all of those kind of little hoops you have to jump through. If they were self-administered, you don't have to do. If they were done by your veterinarian, they'll take just the fact that they have a vaccine on record as enough proof. All right, so any questions about EHV? All right, so this website here is the Equine Disease Communication Center, the EDCC. You can type this into your web browser, or look up just EDCC Equine and it'll pop up. Basically, this is a communication center across the country, and actually it's national or international, that will allow us to kind of track some of these diseases. I'm going to try to pull up mine here for you, but I can't see it. Here it is. All right, so here's a map of the US. I have filters on here currently, so looking for just the neurologic form of herpes in all states in the past 3 months here. So here's the US. This is actually a herpes case that I have been involved in here. So this is the latest one. So in Lorain County, which is about 30 minutes west of me, this farm is currently under official quarantine by the state vet. We had one horse that came up with all of those symptoms of hind end weakness, ataxia, incoordination, incontinence, and then presented down about 5 days into her course of disease. Well, maybe it wasn't even that long. So she started on Friday. Yep, it was day 5. So on Tuesday, she fell down or laid down in her stall and could not get up. So she was euthanized. She tested positive both on a nasal swab as well as a blood test. She was fully vaccinated twice a year. So obviously that didn't give her any protection, but hopefully it's protecting the other horse at the farm. So there's one other horse that is exposed at the farm. And hopefully, so currently that horse is healthy, no fevers, but is under official quarantine. So cannot leave the farm for 21 days and is being temped twice a day to see if he has any signs. This horse is in relation to a horse that was tested positive in Geauga County. So that horse is at a boarding facility. The horse I saw actually attended this boarding facility for a show about 13 days prior to the onset of symptoms. So that horse started clinical signs on February 14th. My case clinical signs started on the 16th. So their signs started within 2 days of each other. They were at the same facility on February 3rd and 4th. So it actually had quite a lag time between the two of them being together and they weren't even close to each other from what I understand. But both horses started showing symptoms about 12 to 13 days after they were at that facility. No other horse so far has been known to be positive, but they currently have both of these facilities quarantined, and this horse is still doing well, although he is affected by hind end weakness and stumbling. He has never shown a fever. He's been mentally alert, eating, drinking, and is currently still doing fine. So certainly some tighter regulations this year as we have some cases that, certainly affect potentially everybody. It's not a new disease. We get occasional outbreaks of this disease all the time. Actually, if I scroll down here a little slower, you'll see there was one in Indiana that happened on February 22nd. This one is in Ontario. And then there's one in Washington state as well. So those are all of the current cases. So very sporadic for the number of horses in the country, but certainly it is one of those reasons why we need to be a little cautious when we're out and about with our horses. All right, that is the end of my presentation. Do we have any questions?
I have one.
Yes.
Can you hear me? Because I put my headphone
in. I
can. So we've been given guidelines to follow when we go to chagrin, which will be new for some of our kids, but the guidelines we've been given are mostly about our horses. So as a person organizing the show, what else can I do to make sure, because like you said, the horses that you're working on was not really near the other horse that had to be euthanized.
Sure.
So clearly that was likely spread by somebody. It's not a horse.
Sure. I guess the question becomes, is there another horse out there that we just don't know about? And that certainly is a possibility, that we had a subclinical carrier horse that went between the two barns that we were not aware of. And so that horse moved from this barn to that barn, and affected one horse or the other. So certainly there's a potential for transfer there. I guess the biggest thing when we talk about these diseases, is, reducing contamination. So that could be limiting horse to horse contact. So you're not letting your horse sniff another horse's nose. You are limiting horse to human to horse contact. So although it's fun to walk down the aisle and touch all the horses' noses, that certainly is a way to spread disease. We try not to use any sort of communal water sources. So horses drinking out of the same container are going to be more likely to spread diseases to each other. We try not to share equipment, which the nice thing about Pony Club is everybody should come with their own. So, not lending people buckets unless they're disinfected. Making sure that we're not dipping the end of the hose into contaminated water buckets. So potentially, I guess, for you having a disinfecting source at the waterer, maybe that's a bleach solution of 1 to 10, and you dunk the end of the hose in it. Certainly, just like COVID regulations, having hand sanitizers for people that are touching things can be helpful, so that you're not touching and, contaminating things. The chief that's touching horses and doing inspections, and all of her helpers should probably be doing normal sanitation protocols. If you've been to big shows where they're doing bit checks, you'll notice that they wear gloves when they do those, and that's so they're not exposing one horse to another horse's saliva. So I guess those are some of the big things that you could do easily. I mean, certainly disinfecting stalls is always a good idea, but it's hard when you're coming into a facility trying to get everything set up. It takes a lot of time to be scrubbing down the stall before you start. So that's what I have.
Okay.
So
we're just gonna have to bring the chief into it, maybe send some information out to the people ahead of time, or we send it out in an email once we have all the entries.
Kind of talking about the
people side, because it's really hard for the kids to walk through the barn and not touch everybody's pony's face.
Sure. Hard for me, but
there was I remember there was a quiz here.
We had to
dunk our boots in
Clorox buckets. And somebody may ask me, tell me we should be doing that. What's your take on that?
I think the more disinfecting you can do, the better. Okay. I think practicality of that is very hard. I mean, during an outbreak, absolutely. I'm sure there's buckets everywhere at Chagrin right now. In the absence of an outbreak, which is hopefully what we're going to maintain for the rest of the season, is no outbreak, just that these horses, these cases have settled down. We haven't seen any more. But practically trying to disinfect your boots every time you walk into the barn is going to be hard.
Yeah.
Okay.
Maybe I can work with you a little bit separately on this too. Sure. As we get closer to rally season. So awesome. Absolutely. All right. That was my only question.
Wonderful. Anybody else? All righty. Well, that's all I have for today.